This is a film to help you and your family understand chemotherapy, its effects on your body, and how you can help yourself. It will supplement the information given to you by your doctor, cancer nurse, and other staff that you may meet. You will also be given an information sheet and chemotherapy booklets giving details of your specific chemotherapy treatment.
Where will I have my treatment?
Day case treatments are administered in the Macmillan Suite or on Ward 5A in Regmore Hospital.
Hello, I'm here for my appointment.
If you live closer to Fort William, Wick, Broadford or Stornoway, it may be possible for you to receive day case treatment in one of our treatment rooms locally. All inpatient chemotherapy treatment must be administered in Ward 5A, Regmore Hospital. If you're having chemotherapy as part of a clinical trial, the research team will contact you.
What is chemotherapy?
Chemotherapy medicines are one of a group of treatments increasingly called SACT, Systemic Anti-Cancer Therapies. The word chemotherapy means treatment with medicines. The word is used mostly in the context of treatments for cancer. Sometimes the medicines used to treat cancer are called cytotoxic drugs. The word cytotoxic means toxic to the cells of the body. Your chemotherapy treatment will depend on the type of cancer you have. Different cancers respond better to different drugs. Sometimes only one drug is required. Often, more than one drug is used to make the treatments more effective. It may be repeated with a rest between each treatment. A course of chemotherapy treatments is called a regimen. Regimens commonly include a number of treatment cycles. Sometimes chemotherapy is used alongside or before surgery or radiotherapy to treat certain types of cancer. Your chemotherapy prescription is checked before preparation by our oncology pharmacists. Chemotherapy medicines for injection are prepared individually for you in a special area of pharmacy using sterile isolators. The pharmacy team have to follow very strict guidelines. This might be why sometimes delays occur.
How does chemotherapy work?
The drug will usually be given as tablets or injected into a vein under your skin or a combination of both. The drug is then carried around your bloodstream to reach the cancer cells. The drug is taken into the cancer cells and may damage their genetic material or DNA. This may prevent the cancer cells from growing and dividing in an uncontrolled way. Cytotoxic drugs damage healthy cells as well as cancer cells, but healthy cells are much more able to recover than cancer cells. When healthy cells are affected, you may get temporary side effects. This risk is why staff and others handling these agents use personal protective equipment. Usually, your chemotherapy is followed by a rest period. This is referred to as a cycle of chemotherapy. The rest period is often longer than the chemotherapy period. This rest or break is important as it gives your body's healthy cells time to recover from the unwanted effects of treatment. This plan or regimen of chemotherapy varies from cancer to cancer. Cycles of chemotherapy can be as short as a week or as long as 6 weeks or more. Your doctor and chemotherapy nurse will explain the details to you.
How is chemotherapy given?
The way chemotherapy is given will depend on the drug and the course of treatment you need. An intravenous injection or drip is the most common way of giving chemotherapy. These injections may be given over a few minutes or several hours or days. The type and combination of drugs will depend on your particular cancer, your health, and which drugs will be most effective and safe for you. You may be given tablets or capsules as part or all of your treatment. The nurse will explain the medicines to you and advise when and how to take them.
Will it hurt?
One of our biggest concerns is not to hurt you. We have a specialist chemotherapy nursing service running in all our chemotherapy treatment areas who are experienced and highly trained. Your treatment nurses have great experience and expertise in putting in patients' needles. This is called cannulation. We always use the smallest possible size needle or cannula to administer your treatment safely. Most of these cannula are placed in the veins on the back of your hand or the lower part of your forearm. Some patients, due to the nature of their treatments, will require other types of lines. If this is needed for your regimen, your doctor and nurse will discuss this with you.
How can I help myself for cannulation?
You may have noticed that when you're hot, for example in the summer or after a bath, the veins in your hands are very big and prominent. Also, when you're cold, your hands and nails look pale and your veins have disappeared. This is your body's normal way of maintaining its temperature. You can use this natural reaction to your advantage. When your veins are prominent, they are easier to cannulate. Therefore, on your way to the unit and while you're waiting for your chemotherapy appointment, try to keep yourself warm. It is also helpful to drink plenty of fluids so that you are well hydrated. If, despite these measures, your veins are still small, we may warm your hands using a bowl of hot water or a hot pack.
What side effects might I get?
Many people have very few side effects to chemotherapy. If you do have side effects, they are usually temporary and will gradually settle after the treatment has finished. You may have reduced blood cell numbers. Chemotherapy often affects the bone marrow. This is where your body makes your blood cells, including red cells, white cells, and platelets. The white cells in your body are really important because they help you fight infection. They are also very short-lived, so they will be quickly reduced by chemotherapy. About a week after your chemotherapy, the number of white blood cells circulating in your bloodstream will be reduced, and this will persist for several days. This means that your body is less resistant to infection, so a minor infection can quickly become very serious. If left untreated, infections can become life-threatening. It is important you call the cancer treatment helpline immediately if you have signs of infection, for example, a cough or sore throat, a temperature of 37.5 degrees or more, any unusual bleeding, bruises, or small groups of red or purple spots or a rash, or if you feel generally unwell but do not have specific symptoms. You will be given an alert card with the Cancer Treatment Helpline telephone number and further guidance on side effects of chemotherapy. You do not need to keep checking your temperature if you are feeling well. Usually, the number of white cells will return to normal before your next cycle of chemotherapy treatment. The other cells in the blood may gradually reduce in number with repeated cycles of treatment. You may become anemic. If this happens, you may be offered a blood transfusion if this is appropriate. Our aim is to control nausea and prevent vomiting as far as possible following your chemotherapy. With many chemotherapy drugs, you will also be prescribed anti-sickness medicines. These may be given by injection or tablets or both, depending on your treatment regimen. If you are given anti-sickness tablets to take home, you will be advised on how you take these by your chemotherapy nurse. There are also steps you can take yourself to minimise symptoms. Eat less but more often. Feelings of hunger can be mistaken for feelings of sickness. Avoid eating fatty or fried foods. Avoid foods with a strong smell or the smell of food cooking. Drink plenty of liquids, slowly taking small sips. Ginger tablets, capsules, or ginger biscuits can be helpful. Don't lie flat just before or after eating. Try to relax, perhaps to music or in the fresh air. You may find wristbands for seasickness can be useful. They are available from chemists. If you're still feeling sick or being sick, despite trying this advice, contact the Cancer Treatment Helpline. Some chemotherapy drugs may cause diarrhea, which usually settles within a couple of days. If you have diarrhea, try to drink plenty of water or other clear fluids to replace the lost fluid. If you have been prescribed anti-diarrhea tablets, take these as prescribed. If symptoms persist for more than 24 hours, contact the Cancer Treatment Helpline. Some chemotherapy, anti-sickness drugs, and pain-killing medicines can cause constipation. To prevent this, try eating more fibre, fresh fruit and vegetables, and drink at least 2 jugs of water or similar liquids per day. If you become constipated in spite of this, your local pharmacist can recommend suitable treatment. If you require further advice, contact the Cancer Treatment Helpline. It is also worth noting that taking lots of medicines for constipation can sometimes cause diarrhea. You may find that you go off some foods after your chemotherapy. This may also happen if you feel sick. You may notice an odd, strange taste in your mouth, or that food tastes or feels strange. This is because the chemotherapy has temporarily damaged your taste buds. If you have a strange taste in your mouth, you may find sucking strongly flavoured sweets, mints, or chewing sugar-free chewing gum can disguise this. Fresh or tinned pineapple can also help with this symptom. If your appetite is poor and you're losing weight, please ask your doctor or nurse for some advice, or if appropriate, to refer you to a dietitian. Chemotherapy drugs will be injected into your vein very carefully. Some chemotherapy drugs are very damaging if they leak into the tissues. Your chemotherapy infusion should not be painful. If you do experience any pain or discomfort during the infusion, please let your chemotherapy nurse know immediately so he or she can check your cannula or infusion device. If you develop this after the infusion, please contact the Cancer Treatment Helpline for advice. You may find that your chemotherapy gives you a sore mouth. It helps if you try and keep your mouth moist and clean. Clean your mouth gently and brush with a soft toothbrush. Rinse your mouth after meals with water. It can sometimes help to avoid alcohol, which can irritate the lining of the mouth, as can smoking. If appropriate, you may be prescribed a mouthwash solution to prevent potential mouth ulcers. Please take this medicine as directed and use it regularly. If you notice small white ulcers around your lips or in your mouth or throat, you may have thrush. This is a common infection of the mouth where people are on treatment. Please contact your GP, who can examine your mouth and prescribe medication if required. Many patients associate the words chemotherapy with hair loss. It is often their biggest fear, regardless of whether they are men or women. Many of the chemotherapy drugs we use will not cause serious hair loss for most patients. However, you may experience a little hair thinning. You may also lose some of your eyelashes, eyebrows, and body hair. Some useful advice to help prevent you damaging your hair is: avoid using hair dryers and other heated styling tools. Avoid using hairspray, hair dye, and perms. Cut down on the number of times you wash your hair each week. Brush and comb your hair gently using a soft brush or wide-tooth comb. If you lose your hair, you may prefer to wear a hat, headscarf, turban, baseball cap, buff, or wig. If you would like a wig to be prescribed, the chemotherapy staff can arrange this. If you do experience hair loss, it will happen about 2 weeks after your treatment starts. The hair loss is temporary and will grow back completely after treatment is finished. Scalp cooling is when a cool cap is placed on the head during treatment to help prevent hair loss. The coldness of the cap cools the cells on the hair roots and restricts the blood flow to them. This causes the cell's metabolism to slow time for a short while. They are then less affected by the circulating chemotherapy. This is not suitable for all chemotherapy medicines or for all types of cancer. Scalp cooling significantly increases the length of time your treatment takes, but it can be effective. Your doctor or chemotherapy nurse can advise you whether this would be appropriate for you. Everyone has good days and bad days, but due to disease and cancer treatments, nearly everyone will experience some fatigue. Fatigue can mean more than being tired and weak. Other symptoms include leg pains, difficulty walking and climbing stairs, shortness of breath, difficulty concentrating and making decisions, low mood. This can sometimes continue for weeks or months after treatment is completed, making you feel irritable and low. There are many ways of combating fatigue and many strategies that can help you to manage your everyday activities. For example, keeping a diary to monitor when you are most tired and when you have most energy. Spreading tasks out over the week. Wherever possible, sitting down to do chores. Asking others to cook and shop for you or use pre-cooked meals. Regular light exercise. Drinking plenty of fluids. Using distraction techniques such as reading, visiting friends, or listening to music. Knowing when you have done enough. The fact that you are having chemotherapy treatment for cancer is very daunting. All at once your whole life has been turned upside down. Future plans often have to be put on hold, and you may feel that your life revolves around the hospital. We do understand this and will try to support you in whatever way we can. We are lucky to have a Maggie's Centre adjacent to the Macmillan Suite. Many patients find it helpful to contact the centre for additional advice and support for themselves and family members regarding diagnosis and treatment. Chemotherapy and the disease itself can affect sexual relationships. Some people may be unaffected by treatment, while others can have changes in levels of desire, changes in tolerance for physical activity, and levels of fatigue. Anxiety and stress can also have an effect on sexual relationships. It is important not to pass on any body fluids to your partner which may contain traces of chemotherapy. Therefore, it is important to use a barrier contraceptive such as condoms for the first few days after each chemotherapy cycle. It is also important not to become pregnant or father a child during chemotherapy or for some time after. If you would like more information on these issues, please discuss it with your doctor or nurse. Unfortunately, some chemotherapy treatments, though not all, cause infertility. This effect may be temporary or permanent, depending on the particular treatment you are having. Your doctor will discuss this risk with you before your treatment starts.
Who can I talk to for advice?
You can contact one of the chemotherapy specialist nurses or the cancer nurse specialist if you have one to help with your type of cancer. They will have given you a contact number at the beginning of your treatment.
Whatever you're worried about, please talk about it, because if you don't talk to me, I can't help you.
A chaplain is available 24 hours a day and is contactable by the switchboard. They are there for absolutely everyone, regardless of faith. They are here to offer a listening ear, help people make sense of their situation, and, only if desired, can provide faith support from all major religions. Keep your tablets or capsules in the bottle or the blister pack that they came in. Store them in a dark, cool, dry place and out of the reach of children. Let your doctor know if you are taking any prescribed medicines as well as any non-prescribed medicines or recreational drugs.
Can I drink alcohol?
You may be able to drink a small amount of alcohol a few days after having chemotherapy, but you should check this with your doctor first. Alcohol is dehydrating, and you should make up for this by drinking more water or soft drinks as well.
Can I go on holiday?
If you have planned to go on holiday when a treatment is due, please discuss this with your doctor. The hospital doctor may delay a treatment until you return. Many patients having chemotherapy will be more at risk from sunburn. To avoid this, use a high-factor sunscreen or cover up your skin. If you do decide to travel and are leaving the UK, it is important that you ensure you have appropriate health insurance in case you become unwell.
You need to look for support. You can't walk a cancer journey by yourself. You take your friends, you take your family, and you all walk it together.